Hi, a very good evening to all of you. Today we are going to discuss the case note of Miss Amy Vineyard. So this is a letter which has to be written to uh, a new community health nurse. So you have to write about the situation of Miss Vineyard and history to the new community health nurse. So you have to address the letter to Miss Lucy Ban, a registered nurse, Community Health Center, St. Hilda. And this is what the primary task is. Let's go ahead with a brief explanation of what we have to see. There are certain background information here that we have to look at very seriously here. Miss Amy Vineyard is a patient in your care at St. Kilda's Women's Refuge Center. So, Amy Vineyard is a patient at Women's Refuge Center. She is 6 weeks pregnant. She presented 2 days ago. Now the main thing comes. She came to request help for her substance abuse problems. This is the highlight. So the reason why she came to the refuge center is to request help for her substance abuse problems. She reports a desire to reduce or cease her alcohol consumption. That's it. So during our care or at the end of her care, the result is she desires to reduce or cease alcohol consumption or to reduce or cease her drug use. So she's ready to compromise her drug abuse and alcohol consumption. But she has been indicated no desire to stop cigarette use. It means she's not ready to quit smoking. So this is what the summary of this thing is. Now she wishes to be discharged, but will require ongoing support throughout her pregnancy. So she is a 6-week pregnant. She came for seeking assistance to help her in coming out of, get rid of the substance abuse problems. So we have evaluated her condition at the time of discharge. She's ready to quit the substance abuse problems or reduce the use of alcohol or drugs, but she's not ready to quit smoking, and this is what we have to see is the picture. But she requires ongoing care and support throughout her pregnancy, and that's why we are writing the letter to the community health nurse. Now let's go in detail. The patient name is Amy Vineyard, age is just 21. Now she got admitted on 6th of January 2009. The diagnosis we do have is pregnant substance abuse. So 6 she came, 7 and 8, 6, 7, 8. This is the duration she was there at our refuge center. Now we have our plan here. So We are going to write to the community health nurse to seek the help of a community mental health nursing team or a community mental health nursing service is needed for Miss Amy Vineyard. At least 2 weeks. And today she's going to get discharged. Following her discharge, 2 weeks, at least 2 weeks, Miss Vineyard needs assistance from community mental health nursing service. Now let's go ahead and see what is she. I don't have her profession here, but she wishes to continue living with her friend at a sofa. It means that she was living with her friend on her sofa, and she wishes to continue after discharge. She wishes to continue with her. Now, after discharge, the mental health nursing service, the community mental health nursing service they are requested to support Miss Vineyard psychologically. Psychiatric support is needed for depression. Now, Alcoholic Anonymous meetings and methadone programs should be there to bring her out of the condition. Now, first trimester ultrasound is there in 2 weeks, and maternal health clinic appointment is needed. This is what the plan is. Now, let's go ahead with the reason here for the admission. So, Vineyard was admitted due to the concern about pregnancy. She is abusive. She has abusive behavior. And she realized that she is pregnant, and she has got the concerns related to pregnancy. And the test was done a day before the admission. She reported pain in lower back, weight loss 6 kg over 2 months. So these are all the reasons for admission. Now, some memory loss, tingling in the feet, difficulty sleeping, excessive worry and hallucination, feeling depressed, history of depression. So these are the problems associated with substance abuse and pregnancy. If you see in total, these problems are associated with substance abuse as well as pregnancy related. So this is what we can see. Now, what we have given at our refuge center is that we have done screening for HIV/AIDS, STDs, nutritional assessment were done, counseling was given. Counseling was given regarding pregnancy too, regarding HIV/AIDS and STD risk too. So we have also discussed the possibility of rehabilitation clinic to come out of the abusive stage. This is what we have seen here. Now, what about her lifestyle is that her smoking habit is about 30 to 40 cigarettes a day. Started 15 years ago, drugs, heroin and all. She started all about at 16 years, at the age of 16. Now she injects heroin and occasionally share the needles. 8 units she consumes alcohol a day, maximum 15 units. So she is a habitual drinker. Now she also started drinking on at the age of 16. Now she lives with her friend at her at sofa. Her friend's name is Sophie, and she has no contact with her parents. And she did have a history of suicidal ideation, suicidal ideation, self-harm. But up till now, she has not consulted any psychiatrist. And this is what a lot of information is here. We have to arrange these things in order. If you look closer to the case now, you can see the things are very relevant to the situation. So we need to reduce the word count. You have a lot of data here. We need to select the most appropriate thing and fit it to the situation. The situation here, the main reason why she came is for requesting help for her substance abuse problem. So you have to keep that in mind. Pregnancy is the secondary problem here. So you have to keep that in mind. So let us go ahead and see how we can present it. It has to be written in an organized way. So the date of discharge is 8 January 2009. Miss Lucy Band, registered nurse, Community Health Center, St. Kilda. Dear Miss Band, reference Amy Vineyard, Miss, age 21. I'm writing to introduce Miss Amy Vineyard, a 6-week pregnant lady with substance and alcohol abuse. She requires ongoing care and support throughout her pregnancy. So that's what I use the word introduce here because you are writing to a new community health nurse. So you have to write the history first because you are going to introduce Miss Vineyard to the new community health nurse. So I have to present the history of Miss Vineyard, the history of drug, alcohol abuse and smoking and blah blah blah. Then only I have to move ahead with the pregnancy and related problems here. So this is what we are planning. Let's go ahead with the first paragraph here. Miss Vineyard, who lives with her friend, has limited contacts with her parents. So fine, this is the social condition, the background. I'm going to introduce Miss Vineyard to a new community health nurse. So I need to say what she is, where she lives. I don't have information what she is, but I do have information where she lives, and that's what we have given here. She lives with her friend and has limited contacts with her parents. She has been a heavy smoker for the past 6 years and has a habit of consuming alcohol daily. Now, for the past 6 years, since the age of 15, she has the habit of smoking. So that's what we have said. And she has the habit of consuming alcohol daily. I'm not telling the exact amount of the alcohol because that's not so relevant here. It's 8 units to 15 units. So it's about 30 to 40 cigarettes. I've kept it in bracket there, so we don't need to keep it outside. It's enough. It's understood that she's a heavy smoker, and she started smoking at the age of 15, and she has a habit of consuming alcohol daily. Now she's known to cannabis since she was 16. Even though she has a history of suicidal thoughts and self-harm, she has never consulted a psychiatrist. So this is what the history of a brief history. I'm not giving a detailed history of Miss Vineyard. What is relevant to a new community health nurse? I have said that she is a heavy smoker. I have said that she is drinking heavily, 8 to 15 units a day. um, I don't have mentioned the units there. I told that she has a habit of using cannabis, and she started at the age of 16. And she has a history of suicidal ideations and self-harm, but never in her life she has consulted a psychiatrist for coming out of these types of thoughts. Now, Miss Vineyard got admitted to our care on 6th of this month with complaints of insomnia and hallucination, and seeking assistance to get rid of her abusive behavior. Now, um, now I just have to make some changes here. I just have to cancel off this, and I just have to read like this. Miss Vineyard got admitted to our care because she was self-presented to us. Got admitted to our care on 6th of this month, seeking assistance to get rid of her abusive behavior. This is how she came. The reason of her presentation on 6th of this month is like this. She was tested positive for pregnancy the previous day and was seen deeply concerned and depressed about her condition. Now I have to state her condition. Now, she was tested positive for pregnancy the previous day. And showed okay. She was tested positive for pregnancy the previous day and showed its complications along with the after effects of substance abuse. Now, I have seen that she has lost 6 kg in the last 2 months. We have certain other things. These are all the, we have a lot of list there: tingling sensation, hallucinations, insomnia. All these things are either complications of pregnancy or the complications or after effects of substance abuse. So this is what we have briefed it there. We didn't list it down. If you have a good language skill, you could list it down. Okay, you can say that hallucination is there, insomnia is there, that is there, this is there. All these things you can include in one particular sentence. But right now I just have included all these symptoms into two heads. One is pregnancy related complications and after effects of substance abuse. So at our care, she agreed to curtail her drug and alcohol abuse. However, she is still hesitant to quit smoking. Okay, so she's still hesitant to quit smoking, but she's ready to cut down or stop drug abuse and alcohol abuse. Now, she was also provided with counseling regarding the risk of sexually transmitted diseases and was given nutritional education. So, I don't know how this is connected because you have screened her for HIV, and you know that she uses needles. She shares needles with her friends when she is involved in substance abuse. So that's the reason that we provided with counseling related to sexually transmitted diseases. But it is not so clear from the case note that she shares needle and all. It's not that much explained in the first paragraph. The first paragraph says that she's known to cannabis. So I have not listed out heroin and all these things. We have a lot of lists there, I think so. Yes. Yeah. We do have injects heroin, cannabis, amphetamines, cocaine, heroin. Okay, so I would say she is known to cannabis, amphetamines, and heroin. Since she was 16. Okay. So this is understood that she's an abuser. She uses cannabis, heroin, amphetamine. So it is understood that we can give her education regarding sexually transmitted diseases and risk of this. When you share needle, it can happen. So this is what we have said in the second paragraph. When we go ahead, so we have briefed her history and we have briefed her present condition there. What happened, why she came, and what is her condition right now, what's the condition. We have said everything there. Now let's go ahead and see what happens at discharge. Upon her discharge today, she's going to get discharged today. Upon her discharge today, kindly provide her community mental health service daily for the next 2 weeks and encourage her to attend methadone programs and alcoholic anonymous meetings. I have to say that she is getting discharged today. Upon her discharge today, from today, kindly provide her community mental health service daily for the next 2 weeks. Okay. And encourage her to attend methadone programs and alcoholic anonymous meetings. This is what the request is. Kindly do this. Please be aware that she has her first trimester ultrasound in 2 weeks and has periodic maternal health clinic appointments. So this is what the next information to the nurse, community nurse. Please be aware that she has the first trimester ultrasound. In just 2 weeks she has, and she has periodic maternal health clinic appointments. If you have any further queries regarding Ms. Vineyard's condition, please do not hesitate to contact me. Your sincerely nurse. Now, If you see in total, even though I have briefed this much data, I have written 216 words up to this. This is what we count, 216 words. I have not included the weight. I've not included the measurement of alcohol she takes. I have not completely said that the drug she takes. I have not completely said why she, what was the condition when she came. She had tingling sensation, insomnia, hallucinations. I've not said, even though I have not said these many information details in this letter, I did cross 200 words. Right now the word count which I have written is 216, and this is the reason I have not included those data, even though it sounds relevant to the situation. I'm not included just because I need to keep the letter in shape. So 220 words the maximum. So that's what, if I go further with she lost 6 kg in last 2 weeks. She was screened for HIV, STDs at our care. Or if I say some other things which are relevant, my word count will exceed 250. And this is how we have to think. And we need to pass the message, but we need to brief the idea. And this is what we have done here. Okay, I hope you must have understood the letter of Miss Amy Vineyard. I hope all the relevant information is included in this particular letter, and hope this is an acceptable sample. We tried to include almost all the data, but still some of the relevant data, I feel it's outside. Anyway, it's well and good. We have presented, we have tried our level best. Thank you.